A number's too big to ignore, and I know too much to go back and pretend.
Hi everybody, it's been a harrowing couple of weeks here at the MAMMBbroads. Last week Anne-Marie jumps out of a plane to celebrate her 65th birthday, and this week she's off to get a mammogram, which is not half as harrowing, ladies. So we urge you, with October, what do we have, 5 days to go, 4 days to go here in the month of October, Breast Cancer Awareness Month. We at the MAMMBbroads are urging all of our female fans, boomer women, younger women, whatever your age, to please get a mammogram this month, next month, whenever it is. You need it, it's important. Now, Anne-Marie, you may speak.
Thank you, Janet.
You're welcome.
The only reason I wanted to do this intro at all is because I am furious with those who say you shouldn't get a mammogram until after 40. Our dear friend Laura would be dead, maybe, had she not gone for a mammogram at the age of 38 with 2 little children. She wound up having a deeply embedded cyst, which turned out to be stage 4 cancer, and has been going through a harrowing round of treatment, but looks to be finished with her treatment. And, you know, my feeling is get a mammogram, do everything you can, as often as you can, to stay healthy.
Well, why did Laura go in? Did she have a family history?
I think she had a family history, and they found a very, very small cyst, lump, that was deeply embedded in the breast, and it turned out to be stage 4, and she never would have felt it on a self-exam.
No, definitely not. Those little calcifications, you can't possibly feel them, and those are the beginning. Although stage 4, she was pretty far along.
They say, you know, what it's done is it's made women feel, you know, more afraid and blah. Yeah, but I'm more afraid of cancer. So, you know, while I'm not thrilled with having to get mammograms and what they might show, and your experience, I also wanted you to share your experience.
Yeah. Well, and this is why I asked about Laura, because obviously when Anne-Marie says that women 35 plus should be getting mammograms, particularly, your doctors will urge you to get it if you have a family history, which I do. My mother died of breast cancer. My maternal grandmother died of breast cancer. And obviously, I have to be very aware of it. I have always felt, Anne-Marie always gets mad at me, but I always think I'm going to die of breast cancer. I mean, it's just a natural thought. If your mother and grandmother do, you figure that's the way you're going to meet your maker. So I have been actually getting mammograms since I was in my late 20s.
Who is your maker, by the way?
The maker.
Okay.
The maker man.
Curiosity.
Or woman. That woman up there. So I just have always been aware, and by the time I think I was 40, my mammogram did show some very, very microscopic calcifications, which are those little, when you see the video that follows this intro, you'll see on Anne-Marie's mammogram, very, very teeny, teeny white dots that might occur in a mammogram, and those are calcifications, which can be a sign of cancer. They can also be nothing.
Early cancer.
They can be nothing, which is why many doctors say you should not get mammograms and not worry about it, because many women have calcifications that are totally benign and no problem.
And I say, hell with them.
Right.
Don't listen to them.
I agree.
Please. And if they were women, they would understand. And I think it's crazy. Just crazy.
But the issue is...
And thank God you do get them anyway.
Yeah. And the issue is, of course, when they saw those calcifications in me, they weren't sure, as they can't be sure, and I think you would agree. Good. I'm glad in a way you want to go further.
Be sure.
Right. Let's
Please
be 100% sure that's not cancer. So they did a biopsy on my left breast and did discover that I had what was called a very, 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 very beginning of possible breast cancer. It was called abnormal cells. There was nothing they wanted to do at that time. Then I, of course, went back for my mammogram the next year, and they saw things again, and they gave me another biopsy. And that is, you know, any woman out there who's had biopsies, it's very disturbing and scary, especially the waiting period from when they do it to when you find out whether you have cancer or not. Those are not good days at all. But they're important to do, and they're important days, and you have to do it. And now, again, I feel every time I go, I cross my fingers, I cross my toes, and since then, I think it's been about 5 years I haven't had anything. But I want to know. And I want to go every year, and you know, I'm not thrilled, but I'm ready.
Don't listen to them.
Go, and find out what the truth is.
And make sure, the other thing is, and you'll see this in our video, make sure that you go to a reputable place, because you really want, not only do you want a good mammogram, but you want a good doctor to be reading those films. Because
Absolutely.
when you see those little white dots, you want to know the difference between something to worry about and something not.
And one of our clients is one of the best. We do represent Mount Auburn Hospital in Cambridge. It's a Harvard teaching hospital.
The Hoffman Breast Center
Is one of the best. Alice Hoffman, an author who many of you may know, was treated at Mount Auburn for breast cancer and was so thrilled with her treatment and so thankful.
and is in remission.
And thank God that she gave a large amount of money to the hospital to form what is now the Hoffman Breast Center, which Anne-Marie and I go to, but in this particular video, Anne-Marie goes and receives fantastic treatment from them. And
Do we have to give is this a PG-13 or?
It's I mean, there
You'll
are
enjoy
things
it.
you'll see here
It's
that
funny.
you probably shouldn't see. I don't know, but
Like
you know,
my tattoo on the right shoulder.
Yes. But you know what? You're adults, and you'll understand that this is a mammogram. So you'll see some things here on Anne-Marie you probably didn't expect to see, but enjoy.
And even though October's almost over, whenever you're due for your mammogram, no matter what month it is, do it. Please do it. On my way to get a mammogram, because I had a breast reduction a few months ago, my doctor wants me to get a new image, which will serve as a sort of a new starting point. Get rid of the old breasts, and this would be a new one. So glad I'm able to do it for Breast Cancer Awareness Month, and you out there, you should be doing it too. Here's my fellow broad waiting for me. Here we are, Hoffman Breast Center. Best breast place to have a mammogram in the country. And here I go. Off I go. Come with me. Let's go. You may not come in with me on this, so you'll just have to wait out here. So you saw me go in looking ravishing, right? Not so ravishing. Someday somebody will figure out a way to do something a little more attractive than these silly little Johnny gowns.
Anne-Marie?
Yes, ma'am?
Hi, how are you? My
Hi.
name's Robin.
Hi, Robin.
Nice to meet you.
Nice to meet you.
You're here
All
for
dressed appropriately.
in pink for
Very
Breast
nice.
Cancer Month.
So what happens now?
Now we're going to, you're going to fill out your history form.
Yeah.
We're going to go into the room and we're going to do your mammogram.
Great. I'll be right with you then. I'll just finish this.
Absolutely.
Okay.
Just call for me when you're ready.
I will.
Okay.
Thank you, Robin.
You're welcome.
Let's go. Now
Ready?
we do the real mammogram. That's quite a machine, huh? Quite a machine. In a minute, my breasts are going to be squished into this thing right here. This little pancake thing, and they will look like pancakes. They won't be pretty, in other words.
Reach here with their, nope, left hand. Right hand, I'm sorry. And left hand stays down. Okay. There it is. Okay, now it's going to come down and it's going to be tight for a couple seconds.
May I just say,
Yes?
a man must have invented this machine. If he had to put his penis in here for a test.
Hello.
Hello?
We all feel good for you now. Now, do we see something here?
Now we see something here. This is usually about 5 to 7 seconds, and we get an image that appears on screen.
Oh, there it is.
In all its glory.
Beautiful, and it looks
All its
fantastic.
smaller glory.
Smaller
Look at that.
glory.
Smaller glory.
The boob.
It's quite a
Looks
pancake.
great,
though.
huh?
It squishes it right down.
I know.
It's
And
fantastic.
somebody asked a question about what do you do with women that don't have enough breasts to squeeze in there?
Well,
you find something.
oh, we always find something. One of the main things we look for on a mammogram is calcium. it's a
Well, you can say that.
That's what I have.
okay,
Yeah.
and really almost probably, you know, 99.9% of women who come in have calcium in their breast. And it's normal to have it, but it also can be a marker for a
precursor.
Exactly.
Yes.
So it makes the radiologist's job really hard because they need to differentiate between what is a good
right.
calcium and bad calcium. So
which is why you do end up with like I've had a couple of biopsies.
absolutely,
to make that
because if they can't say 100% that this is
They
a
go in,
benign
right.
calcium, then they have to go in and make sure that that's what it is.
So do you see anything that would indicate a danger signal in that film?
Well, that would be for Dr. Swami is going to read your film, so I'm going to take them and then I'm going to send them to her.
Okay.
And
she will evaluate them and read them.
Okay.
I would like to say I see nothing, Anne-Marie, and you look fantastic.
I think they look great too, but you know.
All right. Okay, and I'm still smiling.
Still smiling, and you're going to sit back in the waiting room.
I'm going to wait in the waiting room, and then the doctor's going to take a look and tell me whether there's anything to worry about. Okay?
So microcalcifications is one of the reasons, one of the main reasons why we do annual mammograms. And microcalcifications are from a lot of reasons, good as well as bad. The one bad reason that we're looking for is very early cancer. And this early cancer is called ductal carcinoma in situ, which is non-invasive cancer. The early form, and the cells have just started changing and the cancer is still within the ducts. And it manifests, for the most part, as tiny little calcifications, which look like grains of rice.
So you would see those like as little dots?
I would see them, and the whole purpose of getting magnification views, or magnifying it like this, is to see the microcalcifications, to see the morphology, to see the distribution, and to decide whether they are suspicious, or they are, you know, benign appearing, or they are indeterminate, and maybe we need to do something more, like either watch them closely or go ahead and biopsy them.
Okay. And how do I look?
Oh, you look great. As far as your mammogram goes.
Okay. What about the recent advice that we shouldn't get mammograms?
I have seen
disagree?
so many cancers in women that are 38 years old and 40 years old and 32 years old. This is even less than 40 years, which is the age that we start doing screening mammograms. So I definitely totally disagree. And it's not just me, it's American Cancer Society, and we follow the regulations by the ACS.
Well, by the way, it's also women.
Also, right.
I want my mammogram.
Exactly.
It gives me a tremendous sense of reassurance that I've
exactly. And
kept up with my health.
Exactly, and it's such a sense of wonder when I see tiny little microcalcifications, maybe a 5-millimeter cluster that I know is cancer, but I know it's just going to get scooped out. There's going to be a tiny little lumpectomy, and the breast is going to look great, you know. And
you probably saved a life.
Exactly, and it's healed, you know. It's treated. It's treatable cancer. I mean, how often can we say that about cancer?
Really.
So the whole purpose is to, you know, get really tiny little cancers out, and we have all this.
You have the technology that can help
us.
you. Right.
Yeah.
Why not use it? Right?
Exactly. So,
but thank you
absolutely.
so much. I feel like I should hug you. Really, thank you so much. Really, because that's the news you want. And part of the reason for us doing this is to tell people this is important. This is very important, no matter what they say. Have your mammogram every year. Have your annual checkup, and make sure you do it religiously. It's very important. And make sure you go to a good place that will actually take the time to look at your films the way Dr. Swami has.
Thank you.
Thank you so much, Doctor.
Absolutely.
Appreciate it. Thanks a million.
The printer is broken. Okay.
Here you go, folks. Here you go. I bequeath this to the next patient. From a mammogram. When you're hearing normal. And as Jan Aprensky said, it wasn't a mental health exam, so it's not normal up here. It's just normal in here.
Tuesdays.
Thanks, everybody.
Once a week.